All right, we'll get started now, and as people join, they can get caught up. So I'm Jonathan Rogg. I work down in Houston, Texas, at McGovern Medical School.
My name is Alex Chang. I work at Boston Medical Center. Welcome.
And I'm going to give you guys an outline of what we're going to do today as part of this session. So the first thing I'm going to talk about is basics of negotiation. And I'm going to give you some key terms and some reasons why negotiations is an important skill to have for an emergency physician. After that, we're going to move into an interactive negotiation practice, which I promise is low stress and low key. And when we've done this with other audiences, it has been the part that they like the most of this didactic. And then we're going to come back and talk a little bit about negotiation hacks that you can use in any type of negotiation, but focus a little bit more on job negotiations in particular. And then we're going to, at the end, look how everyone did on their practice negotiation and kind of look at just some summary statistics of that. All right, so the first thing that I want to talk about is why negotiations is important. Negotiations is something that you don't get when you go to medical school. Now, if you go to other professional schools, interestingly enough, if you went to business school or if you went to law school, you'd probably have a whole course on negotiation. So compared to your peers who went to other professional schools, you're relatively at a disadvantage compared to them. So one of the questions I get asked a lot is, how do I get better at negotiation? And the answer is practice, practice, practice. And there's lots of opportunities for you to practice your negotiation skills. When you buy a car, when you purchase your house, if you want to convince a consultant to see a patient in a timely manner, or if you have that patient who's non-compliant, try to get them to take their medications, that's part of a negotiation. When you negotiate for a job or ask for a raise, that's another great example that we see in our everyday life. Or if you're traveling around the world and you're trying to buy something at a souvenir shop, that's another great place where you can practice your negotiation skills as well. So negotiations is really about coming to an agreement. And the first term that I'm going to teach you guys about is something called ZOPA. ZOPA is the zone of possible agreement. It's the overlapping range where an agreement benefits both parties. So when you have a large ZOPA, a large zone where an agreement would benefit both parties, that allows you more room to maneuver to make a better deal. However, sometimes you only have a small ZOPA, small intersecting zone where you could possibly make a deal, and that can make getting a deal difficult to get. And sometimes you run into a situation where there is no ZOPA, at least there is no positive ZOPA. So there's no place that both parties can make a deal that would make them better off. Now, notice I said there's no place that they can make a deal that would make them better off, not that they didn't get a deal. Because it is still possible to get a deal even if there is no ZOPA, but it means that at least one party is doing themselves a disservice and getting a worse deal than they started with. So obviously this is the type of deal that you definitely want to avoid. Now, the next thing I want to talk about is something called BATNA, which is why I have this picture of a bat. And BATNA stands for the best alternative to a negotiated agreement. And essentially this is talking about your backup options. The more high quality backup options that you have, the stronger your BATNA is. This gives you more leverage in your negotiation if you have a viable backup like a job offer or another job offer if you're looking for a job. And doing nothing is also a very acceptable BATNA. So for example, if you're going to go buy a car and your car still runs, but you're looking at different models and makes of car, and there's none that really fits your right price point or has the features that you want, your BATNA may be that you can go back and just stick with your old car, and that is perfectly acceptable. Now, I think a lot of what I talked about there is pretty obvious to know your backup plans. But the other thing that you want to think about with BATNA is you want to think about the BATNA of your counterparty that you're negotiating with. What are their backup options? Because that will tell you a little bit about how much leverage you may have in that negotiation. And so thinking about your counterparty can be really beneficial. I'll give you an example. So let's say you're applying for an emergency medicine job at a rural facility that you know has been looking for an ED doc for 9 months. The amount of leverage you have in that situation is going to be very different than if you apply for a job in a big city that you know has multiple people who've put in their application for that same job. So thinking about your counterparty's BATNA is a really important step into getting a good deal when you actually do a negotiation. Now that's a brief high-level intro of some important terms in negotiations. And now is time for you guys to practice and do the practice scenario that we have set up for you guys in this negotiation. And Dr. Shang is going to take it from here.
Yeah, so in order to get your negotiation juices going and further prime your learning, we're going to do a 15-minute negotiation exercise. And if you don't mind, check out the chat, and I have a link that goes to the specific instructions. There should be, what we're going to do is we're going to divide all of you into groups of 2 into breakout groups. Each of you will be assigned a role, and all the instructions are within that link. And I will copy and paste that here just in case. So I know it's a lot of chat, but essentially the concept is very simple. One of you will take on the role of the medical director. One of you will be taking on the role of an emergency physician, and you're going to try to find a point where you can agree on the salary and perhaps the number of days off. And if you don't mind, at the end of the session, whoever ends up being player A should be filling out this form that we're going to collate all of the results for, and kind of show you guys a summary at the end.
And if you have any issues, Margaret from SAM can help place you in a proper room, or if you have any issues, you can send a message to her and she can get you into the right place.
All right, we're gonna break you guys out into rooms now. Margaret, do you mind doing that? Are you doing that already? Probably.
Yes, I'm putting them in breakout rooms now.
You would be the player A, so you'd be the emergency medicine physician.
Okay.
And I guess I would be the medical director, the acting medical director.
All right, so let me click on this link here.
Hi, I'm Margaret. I'm just here to record this session and just to make sure that you're okay.
We're okay. What are the rules of this, other than seeing the negotiation instructions? Is there any particular theme that we're going to do, other than it seems like this is a hiring
No,
session?
just have a conversation between the two of you to discuss, salary, I believe. And then I think it says player A with the closest birthday to January is player A, and then you'll be player B. Did you click on the Google Doc?
Let's see now. I got something other than just negotiation instructions, but that was it. It didn't really mention about what are we negotiating about.
Your salary.
Just salary.
Well, actually, you know what? It could be anything. Like he said, you could be negotiating a patient that does not want to take their meds, or really pretty much anything that you want to negotiate. So you would pick the topic.
Oh, okay.
Huh.
So Hannah, any particular topics would you like to negotiate about?
I mean, I'm just reading like the player A thing, and the only option they really include here is salary equivalence. But I don't mind going off script.
Going rogue.
I don't know. You're the medical director. Any thoughts?
Let's see now. How about instead of salary? How about something more tangible, like decreasing the number of hours? I assume you're an academic doc as well.
I work at kind of a mixed setting right now, where we're technically a teaching hospital, but we're flying under the community banner. We're the community site for an academic center.
Okay. How about reducing the hours, and so you can increase teaching time, I guess?
Sure.
Sure. Okay. Hi, Hannah. You're coming in to talk to me about your hours. Any particular issues with this?
I wouldn't say issues per se, but I find that the part of our job that gives me the greatest pleasure, that I get a lot of great feedback about, is getting to teach and work with the residents. So I was wondering if we could discuss that and possibly balancing a schedule that allows me to do that a little bit more as part of my daily responsibility.
Oh, absolutely. So I don't have your file in front of me. What is your current hours per week?
Currently, I work about 5 shifts a week, so 50 hours a week, but that doesn't include the offline hours that include resident teaching and presenting sims and giving them lectures and things like that. That's mostly been on my own time right now. So you can kind of round that up to about 65 hours if you include all of that. But I think that it would be more beneficial if I could take on that role in a more official capacity.
Oh, okay. So what were you thinking about? What hours are you thinking about that you'd be successful?
I think perhaps we're making a reduction of maybe 1 shift less a week would allow me to do that more effectively. But also, if there's any leadership opportunities available, I'd love to explore those.
And what leadership opportunities were you thinking about?
So at the current moment, I know we do a lot of simulation, but there's not really a director or anybody responsible for taking on the responsibility of making it more of an official program. So that would be one that I'd be interested in.
Oh, okay. And then in terms of that, how many hours do you think you'd be successful if this position came up?
You know, that's a great question. We don't currently have a fabric in place to say. I think there'd be a lot of groundwork in initiating such a program to begin with. So I'd love to hear from you about what availability there is and what we can do to work in within that.
Yeah, I agree with you. I think we do need a leadership person to do the teaching. What I see is we need a curriculum, and we need dedicated teachers to fulfill that. And but I'm also worried about the coverage of the clinical hours as well. Taking down 1 shift, we're talking about we're taking down about 10 hours of your clinical responsibility. That's like almost like 20% reduction in terms of your actual clinical time. For these 10 hours, I mean, how do you deem, how would you say to allocate these 10 hours for this teaching responsibility?
So I think that if we consider that resident education usually happens on Wednesday mornings, our department is already covered during that time to account for the lack of a resident in that care space. So if my schedule could align more to a resident schedule in regards to just that 1 day a week, we already account for her coverage. And if I'm already assigned to a Wednesday morning to begin with, I'm more than happy to perhaps not step in educationally on those days.
Okay. Okay.
I think that might ruffle the least amount of feathers, especially within our group.
Right. That sounds like a potential possibility. And then do you see a lot of time off hours or off clinical and off teaching hours that you see yourself dedicated to?
I think without a doubt, especially in the beginning, while the establishment of this program would be a lot of offline work for sure.
Mm-hmm.
But if you've maybe heard of anybody else who's interested in joining, the wagon here and has an educational interest, that might lessen the burden and be even more beneficial overall to get more brains involved.
I like it. More people involved. And then and what kind of resources do you think you will need for this?
It's a great question. I'd have to look into it a little bit further, but there's obviously the first step is just creating more of a space. And we do have a couple of spaces that I have in mind that we could use, but there's a lot of really economical sim options out there nowadays. So it really depends on what kind of budget we'd be able to look at. We could obviously go very high end and very high tech and get these great models. But there are easier ways. And I think that we could have a meeting later on down the line to see what focus our sim program would want to take. If it's more procedurally based, if it's more case based, I think each has its own set of needs, and obviously each comes with its own budget.
Right. And then how do you see, how do you think we can measure our success if when you, if that opportunity arises of you taking this teaching opportunity?
Well, thankfully we have a ready and willing participating audience here in terms of our residents to be able to pull, and I think we could all actually publish some great data and see how they respond to the measures we're going to take.
Okay. Do you expect their board score or in-service exams to improve with this?
I think the more education we incorporate into their training, definitely that should show an improvement. But we could also measure it through their clinical milestones and their proficiency with procedural skills as well.
Okay. I mean, your thought for like having taken one shift actually sounds very, very reasonable. I think what we would need is just outline a particular, I guess, schedule for you and see what we need to, milestones that we need to hit for each quarter, saying that we're moving along and that we're hitting our success as the teaching program goes for the residents. But reducing one shift a week sounds like a reasonable option, given that it's provided during the teaching hours, and sounds like you have a clear enough plan of what we may need to do in terms of like sim, in terms of like having them do well in their educational process.
Thanks for the support.
Yeah, that's a verbal agreement of support. Just I guess we would need like a calendar or framework of what that success would mean.
Absolutely.
Are we done now?
I think we did great.
It's a win-win for all.
To have some numbers of the salaries and consent days off that you guys were able to agree on?
We wound up negotiating on decreasing number of hours.
Oh, okay. I see. No, that's fair.
Clinical responsibility to engage in for teaching. I acted as the director of the ED.
That makes sense. Yeah, a lot of the non-money related things that make life easier, right?
Yeah, sorry, that's why I didn't click on any monetary answer.
No, that's okay. You know, money doesn't make you happy. That's good.
All right, we'll start once we close the breakout groups. Looks like they put something in, so I think they're done.
Awesome.
All right, is everyone back? I think everyone's back in the main the main group so we can get started here. All right, so we're going to talk about negotiation hacks, but before we do, I want to start with asking everyone to do a brief exercise. So I know all of us are very good at using Google, so don't use Google. I want you to do this just from your own memory and from your own knowledge. And if you feel comfortable putting it in the chat, you can put your answers in the chat. If you want to just write them down at home, that's fine as well. So I have 4 questions for you. And the first question is, are there greater or less than 20 countries in Africa? Greater than or less than 20 countries in Africa? All right, the second question is, how many countries are in Africa? So we need a number.
You're welcome to kind of just give some guesstimates in the chat, whatever you feel comfortable with. You can keep it to yourself if you like.
Either way is fine. Now, the third question is, are there greater than or less than 20 states in the United States? And the fourth question is, how many states are there in the United States? And so my question for you when you look at your answers is, I'm curious how many people have a number of African countries that is less than the number of states. And I assume most of you for the number of states, but some were number close to 50. And in truth, Africa has 54 countries and the United States has 50 states. So you would think those numbers should be the same. But what you'll notice in most cases is that because I've anchored you on the number 20 by asking you if there are greater than or less than 20 countries in Africa, most people will pick numbers less than 50 for the number of countries in Africa. But you'll also notice that for the last question, which is how many states are in the United States, most people will actually put 50 states. And the reason for that is you guys have a lot of knowledge about the United States, and so you're not going to get anchored. And the first concept that I want to talk about is anchoring bias. Anchoring bias is not something that's just for M&M conference. It's something that humans unconsciously do where they place weight on the first number they hear in a negotiation, if you're talking about it in the context of a negotiation. So if you make the first offer in a negotiation, you want to use that for your advantage. Conversely, if you're not making the first offer in a negotiation, then you want to remember that splitting the difference doesn't always make things fair because of anchoring bias. And so you should stick to your guns about what you think is fair in a negotiation. Now, you can't just be all over the place. You can't just go into a job negotiation for salary and say, I want to get paid $1 million, because that's not going to work. Similar to our example, having knowledge about how many states are in the United States will be helpful to you, but it's not the be all and end all to just pick numbers that are totally at random. So if you're smart and you say, I know that there's other doctors making X amount of dollars, then that's a good place for you to start to try to anchor on that number to try to get that salary in a negotiation. Now, another thing that's really important is that oftentimes when we negotiate, we aren't just negotiating on one thing, such as money. We're actually negotiating on a bunch of different things. And this is called a multiple issue negotiation. And oftentimes things that are of non-monetary items can actually have a lot of personal value to ourselves, because people value items very differently. A lot of times in a multiple issue negotiation, you can use that to your advantage to find the things that really matter to you when you go into that negotiation. And we see that all the time in emergency medicine as well. So again, I'll give you an example. Many emergency medicine jobs have a differential for people who work nights. And the reason for that is some people don't mind working nights. And so they're more than willing to work a lot of nights to get paid more money. Whereas other ER docs don't like to work nights. And in fact, they have much better quality of life by not working nights. And they're more than happy to get paid less to not have to work those overnights. So that's an example of the trade-offs that you can get in a multiple issue negotiation. Now, another thing that's really important when you negotiate is relationships. And relationships matter a lot. So the first question I always ask myself when I go into a negotiation is this a repeat game? Am I going to be negotiating with that person or that entity again? So I'll give you the example. When I go to buy a car, I actually don't care that much if the salesman has a lower commission when I buy that car. I want to get the best deal possible, even if the salesman isn't getting a great deal. However, when I'm negotiating with my wife, I want to make sure that she doesn't feel bad after the negotiation. I know that I'm going to have to live with her and negotiate with her again. And so if that changes the dynamics of the negotiation, if it's a repeat game. In truth, an expert negotiator will make you feel like you got a great deal, even if you didn't, because they care about that relationship. Now, ultimately, I want to just give you some general advice on negotiations. Money is certainly important, but at the salaries that ER docs make, more money generally doesn't make doctors happier. As a result, what we can't recommend to you is focus on things. Money is important, but you want to make sure you focus on other things as well. So for an academic salary negotiation or job negotiation, things like CME dollars, specific time of the year off, buy down, those are all things that you can negotiate that have non-monetary value that can really add to the quality of your life. Your mental health and that of your family should always come first in a job negotiation. And my own opinion on this is that one of the most valuable things you can get at an academic job negotiation is mentorship and job satisfaction. That has a ton of value that to me is even more valuable than money. So when you go into a job negotiation, think about the things that really matter that have non-monetary value. Job negotiations are ultimately a repeat game, and you want to get a good deal, but you want the person hiring you to feel good about making the job offer to you. And so that's part of the dynamic you want to always consider when you enter a negotiation. And ultimately, the last piece of advice I want to give you is to know your worth. Research how much ED docs make in the area or at the institution that you work at. I'll give you, again, another example. I work for the state of Texas. If you look with a little bit of Googling, you can figure out what my salary or any of my colleagues' salary is because it's public information. So you should have that information to know about not only about yourself, but about your counterparty when you go into that job negotiation. Also, what I recommend is not talking about money first. Talk about other things, how you're a team player, you're going to see patients efficiently, you write good notes that are going to allow the institution to bill at higher RVUs. All of those things are good things to talk about when you go into a job negotiation. All right. Alex is going to talk to you a little bit more about how you guys did in your negotiation. I know there were only a couple people who participated, but I still think it's worthwhile to go over this, and we'll give you an opportunity to ask questions at the end.
All right, so these were kind of the conditions for your negotiation that you guys were under. Each player was given a salary range in emergency medicine, generally a physician in that area, generally made 250 to 500K. The medical director generally expected to pay 200 to 400. And you were also asked to negotiate consecutive days off as a salary equivalent. And obviously, when you have days off, it means more to the emergency physician than it does to the medical director. So 0 days off is not worth anything to either party. 3 days off a month is worth at least $85,000 to the emergency physician and less to the medical director. And similarly for the 4 days off, which is worth more to both parties. So this is kind of the table showing the results of your negotiations. There's only a couple of groups. And the average salary was $250,000, and no days off were negotiated. And you guys must live in San Francisco or in Boston or somewhere where I am, where I get paid like crap. But appreciate your work and working through this negotiation. And the other group actually had some other ideas about what meant more to them than just money. Hannah and Jeff, do you guys mind talking a little bit about your experience with your negotiation today?
Sure. I mean, we talked about reducing clinical time to have the emergency medicine doc participate in teaching. And so it was thrown out that reduce 1 clinical shift per week, and the base work time was 5 shifts a week. So that the shift is constituted like 10 hours. So we talked about what were the responsibilities to the learners and what was involved in terms of like establishing a learning program, or at least someone's going to direct the learning objective. So what we wound up doing was marrying the 1 shift over the times when the residents are learning, specifically at this hour when coverage was at the highest from the faculty, and the ED doctor was going to develop a plan to develop a curriculum for the resident. So for the 1 shift reduction, it gave them an opportunity to teach at a covered clinical time.
That's great. Yeah, there's definitely, value in terms of both lifestyle and work satisfaction as well. Jesse and Katie, do you mind talking a little bit about your experience other than finding you guys were born in the same month and probably have the same zodiac sign?
we did not get into zodiac signs. So I think we may have kind of broken the rules because we did not get as sophisticated as the other group. But identifying that 4 consecutive days guaranteed per month was what was important to the physician, but my language actually said 4-day weekend. So I spent 4 days in the middle of the week every month, and it was relatively easy from there. And then, we talked a little bit about other things like, other vacation time and shift requirements, but not quite that sophisticated. It was really just finding that loophole that would make us both happy and get us both the monetary equivalent benefit.
Awesome. Thank you. So, Dr. Rog, do you want to sum it up?
Sure. So in summary, remember, we want to pay attention to our ZOPA, our Zone of Possible Agreement, establish what your BATNA is when you go into negotiation, be aware of anchoring bias like we talked about in that example, and always remember to consider your counterparty because that will give you a lot more leverage in your negotiation. Think about the things that really matter to you, and often those are non-monetary things, and do your research before you enter a negotiation, both about your job and where you're going to go. And the last thing to remember is to know your worth. Don't sell yourself short. You guys are educated, smart physicians. You bring a lot of value to wherever you go, and make sure you get compensated in some way for the great work that you do. That's all we got. If there's any questions, feel free to reach out to us. We'll stick around here for another couple minutes. I know we're ending a few minutes early if people have questions. Thanks, everyone.